and he's looking around. Please share this with everybody you know. Share it with your contact list because this is really important stuff. And if you're not following me on all platforms, please follow me on all platforms. So, all right, John says I'm ready to go. So here we go. Ready? Hey, folks, Dr. Joe Esposito here. We're talking today about a pain management diet. All of us have some type of pain. I've been in practice 40 years now. And I was just talking to one of my secretaries earlier. And she said, the one thing I loved about that show, House, is she says, House would always say, every patient lies. And I thought, yeah, because when I do intakes with my patients, many times it's not an intentional lie. No, I don't have any problems, except I can't turn my head to the left. Or my arm goes to sleep if I move it a certain way. Or I have shooting pain down my leg. Other than that, I have no pain. So pain management diet is important. And this is something nobody really talks about. Because what you eat has a direct impact on your pain levels. I'll tell you a personal story before I jump in. I was hit by a car when I was 10 years old. I was in a coma for several days. So I have what's called a severe traumatic brain injury. Have, not had, have, because it never really totally heals. And it took me years to figure out I can't do caffeine. If I do caffeine in any form, chocolate, I don't do sodas, but sodas, teas, coffee, blazing headache. So that was a real simple pain management move for me. I just stopped doing caffeine. How's that for an easy fix? So let me start by saying this. The most effective, least expensive treatment for pain is chiropractic care. So if you have pain, for most pain, I mean, if it's a tumor on your brain, maybe chiropractic care isn't the thing. But for most pain, chiropractic care, most effective, least expensive. So that's where you want to start in your pain management journey. And I'm board certified in pain management, so I'm very familiar with dealing with pain patients. So let's jump in and talk about foods that are good for you if you have pain and foods that are bad for you if you have pain. So you want to eat at least 5 servings of fruits and vegetables every day. This is so important, not just for pain, but for overall health. Because they're packed with antioxidants, and antioxidants fight inflammation. We'll keep it simple there. And inflammation can cause pain. Every disease known to man has an inflammatory component, just so you understand that. So we want to make sure we're doing everything we can to reduce inflammation in our lives for multiple reasons, not just for pain. And if you have inflammation and what we call oxidative stress, these are molecules like Pac-Man that eat through your cells and eat through your body and eat through your nerves. That's real simply put. You want to reduce that inflammation and oxidative stress. So simply 5 servings of fruits and vegetables a day. More is better, but at least 5 servings of fruits and vegetables a day. You can shake it up, 3 and 2, 3 fruit, 3 vegetables, 3 fruit, 2 vegetables, vice versa, whatever it is. Just make sure you're getting your fruits and vegetables every day. Now, green leafy vegetables are amazing for so many different reasons. They're rich in magnesium, and magnesium helps relax your muscles. About 60 to, depending on the study you read, 60% of us don't get enough magnesium in our diet. And that's just the minimum amount of magnesium. I always say there's enough to survive and enough to thrive. That's enough to survive. A certain amount of people are. To thrive, you're going to need more than that. Magnesium works on over 300 different functions in your body. 350 is the last count I saw. And so magnesium is really important. And most of us are deficient in magnesium. So you're going to knock out 2 birds with 1 stone here. If you have the green leafy vegetables like a salad, you're going to get your magnesium dose, and you're going to help with the 5 servings of fruits and vegetables to give you the antioxidants to fight the free radicals to bring down the inflammation. That's why I recommend you consider a salad once a day. I usually have a salad, I'd say almost every day, 6 out of 7 days probably. And salads loaded with nutrients, and they're raw. Now, raw food have different nutrients in them than cooked foods. So if I eat raw spinach, I'm going to get a certain amount of nutrients. If I cook the spinach, I may destroy some of the things I'd get in the raw, but I'll free up other ones. And so that's why I want you to consider something raw and something cooked. You can have a little combination of the both. Raw food, there was a movement a while ago on raw food diet. Everything should be raw. I don't necessarily agree with that. Some people may argue with me. It's my show. I can talk whatever I want, right? So have a salad every day. And when you make your salad, I don't want you to just have lettuce or spinach because that'll be boring. And you'll say, oh my gosh, another salad, I'm so bored. So I want you to shake it up when it comes to your salad. Now, a couple of things you can do. If you want the salad to be a meal, which I like to do, you can add something like chickpeas to it. You can get a can of organic chickpeas, $1.25, $1.50 maybe. Rinse them off, put it in your salad. You just turned a salad into a whole meal. Because the chickpeas have all the amino acids in them that you need. People say, well, you can't get a certain amino acids from a plant-based diet. You can. That's not true. But chickpeas kind of have the full spectrum there. You can use black beans, red beans, cannellini beans, whatever you'd like. Add some sunflower seeds. Add some pumpkin seeds, loaded with zinc, loaded with magnesium. And when you start having this variety, sesame seeds, I was on a sesame seed kick for a while because I bought this big bag of sesame seeds at a Middle Eastern store. If you buy sesame seeds in a grocery store, very expensive. Go to a Middle Eastern place that sells Middle Eastern food, and way less expensive. So I was putting sesame seeds on everything for a while. You can use apple cider vinegar because apple cider vinegar is actually anti-inflammatory. It alkalizes your system. Most vinegars make you acidic. And acid, you pour acid on a cut, it's going to hurt. So you want to alkalize your system. Apple cider vinegar is the only vinegar really that will alkalize your system. The other ones make you more acidic. So if you make a salad with apple cider vinegar, that's great. Now, I don't like tart foods. I'm thinking about lemons right now, making my mouth cringe. I don't like tart lemons. I don't like tart vinegar. So what I'll do is I'll use a little bit of apple cider vinegar, and then I'll use some balsamic vinegar as well, and that kind of cuts it a little bit. If you're going to use an oil, you can. Make sure it's extra virgin organic olive oil. How do you know if it's a good olive oil? What you want to do, and I was just in a store the other day looking for olive oils, and they had one. It was a buy one, get one free organic olive oil. I got so excited. Oh my gosh, this is the deal of a lifetime, right? And I looked, and the olive oil was from multiple sources. Greece, Tunisia, Italy, Spain, whatever, a bunch of them. If you have that, chances are that's not pure olive oil. Because somewhere along the line, somebody's going to throw in some soybean oil or some seed oils, the bad oils, and dilute the good olive oil. I like extra virgin organic olive oil from one source. Could be Italy, could be Spain, could be Tunisia, whatever it is, that's when I find you get the best. And here's how you tell. Take your olive oil, put it in the refrigerator. If it gets cloudy overnight, the next day, it's a good olive oil. If it doesn't get cloudy, it's cut with some cheap oils. It's very simple. Now, depending on the study you read, it can be up to 80% of the oils in this country, in the United States, have been cut with cheap oils. So extra virgin organic olive oil or avocado oil, usually that's pure. You can do that as well. I wouldn't use any seed oils at all because one of the many things that seed oil does, it increases your inflammation. And inflammation increases your pain. And what are we talking about today? Pain management. So stay away from the seed oils. Stay away from peanuts. Peanuts are high in omega-6 fatty acids, which are inflammatory. Now, you can do walnuts. They're okay. Almonds, pecans, pistachios, those are all fine. But the peanuts will really increase your pain levels. So a lot of people who are chronic pain patients are sitting around eating junk food. I'm in pain. I can't go out. What do? I eat the typical American diet, what I call the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweeteners, which is most people's diet anyway. So people are eating alcohol, meat, sugar, dairy, coffee, soda, and artificial sweeteners. They're eating things like peanuts. They're eating these fake oils, not fake oils, but these seed oils, and they're in constant pain. And they've done drugs, and they've done other things, and maybe they've done injections, maybe they've had surgery, and they can't get out of pain. Not saying this is the only thing that causes pain, but it contributes to the pain. If you're in pain, what do you want to do? Get out of pain. So stop contributing to your pain. Stay away from white breads and pastas, white pastas, because they're loaded with sugar. So what you want to do, and I've taught this many, many times, is you want to make any carbohydrate you have a resistant starch. Now, white flour should be gone out of your life. But if you're going to do it, and I wish you wouldn't, but if you're going to do it, again, I wish you wouldn't, you want to cook the pasta or the rice, cool it overnight, put it in the refrigerator, eat it the next day. About 40% of the sugars now convert into what we call prebiotics. and it becomes a resistant starch. So you absorb about 40% less sugar. Less sugar you have, less inflammation you have, better for pain management. Now, you can do pastas made with things like lentils. Lentil pasta. That's an okay pasta. I tried edamame pasta already made with soybeans. I didn't like it. I'll be honest with you. But the lentil pastas are fine. I like them. Now, they don't taste exactly like white flour pastas, but you kind of get the idea. But again, cook it, cool it, eat it the next day. For breads, the only bread I find that I would recommend is what we call sprouted bread. And they take the grains, they sprout them, dry them, grind them into a flour, and use it that way. Ezekiel is a brand name. Sprouts has their own brand. Kroger has their own brand. With bread, you want to take them, even if you buy them at the store, freeze it, then defrost it and eat it. And now you created a resistant starch with your breads. I like breads. I like white pasta. I'm Italian. Okay? You could also do gluten-free pastas. It's still sugar, but you don't have the inflammatory reaction that a lot of people have with gluten, which is found in wheat. Either way, cook it, cool it, eat it the next day. Don't have it every day. I'm just trying to make it usable for you. Okay? I know people are people have a tough time changing everything all at once, so I'm giving you little baby steps here. So eat more berries. Blueberries, raspberries, strawberries, loaded with flavonoids, and they're anti-inflammatory. Frozen works just as good as fresh. Now, I have a fig tree in my backyard, and when fig season comes, I have way more figs than any multiple humans can ever eat. So what I do is I'll freeze them. I'll wash them, freeze them, and then I'll put them in my smoothies in the morning. Because in the morning when I wake up, the first thing I have is Dr. Joe's Super Greens, Dr. Joe's Essential Source, vitamin D3, and then I add the frozen berries to it. And figs are great, and I just happen to have a lot of them and they're very expensive. I don't usually buy them because they're too expensive. But you can use frozen berries just as well as fresh, and they work just as well. And it works really well with your Super Greens and Essential Source in the morning. Add some coconut milk, almond milk, soy milk, organic soy milk. I got a little magic bullet. I throw in the Super Greens, the Essential Source, my 10 drops of vitamin D, creatine. I'm going to recommend creatine. This is something new I haven't talked about much, but I have the samples. They'll be coming in the next couple of weeks. But creatine helps with brain function. I just read a study that people with Alzheimer's respond very positively to very small amounts of creatine, 5 milligrams. It's a little tiny scoop. And so it's very inexpensive. Like the containers we're going to have are 100 servings. Very inexpensive. You just need a little bit, and it also helps build muscle mass. Because something that happens as we get older, related to pain, is we have something called sarcopenia. Sarcopenia is the muscles becoming weak. And you lose about 1% of your muscle mass per decade. So 1% of muscle mass per decade. So if I'm 30 years old, by the time I'm 60, even if I work out on a regular basis, I'm probably going to lose about 30% of my muscle mass. Creatine helps preserve that muscle and help the brain. So now you make this amazing shake in the morning. And again, you could just use coconut milk, almond milk, and just add the Super Green Essential Source and vitamin D. But if you add some berries to it, you're helping with your pain management protocol. And you're getting a lot of good nutrients. Then you add the creatine to it, the vitamin D. Man, super way to start your morning. I look so forward to it. I'll wake up in the morning. Sometimes the alarm wakes me up. Sometimes I wake up. And my first thoughts are, looking forward to going into the kitchen and having my Super Greens and Essential Source. And you should. And by the way, all those supplements are on my website, drjoe.com, drjoe.com. So adding berries is a wonderful way to help with your pain management protocol. We talked about extra virgin organic olive oil. Make sure it's a pure one. You don't want to use the ones that are tainted. And you want to get more omega-3s in your diet. We should have a ratio of 1 omega-3 to 1 omega-6 molecules. Most people have 20 omega-6s to 1 omega-3. Some people have 40 omega-6s to omega-3. You cannot control pain with that much omega-6 fatty acids in your diet. It's so inflammatory. So I take Dr. Joe's omega-3 supplements every day because they're necessary for brain function. I take 2 capsules a day. The bottle says take 1. I take 2. And I just had my omega-3s tested, and I'm on the low end of acceptable. Even taking 2 a day, I'm on the low end of acceptable levels. If I tested most of you out there, I could almost guarantee that most of you would fall short on omega-3 fatty acids. They're essential for brain function, essential for anti-inflammatory and pain management. It's part of what I call my supplement stack, and it should be part of yours too. They're not cheap. Of all the supplements, they're probably the most expensive supplement we have, but it's well worth it. And again, if you're not doing coffee, you're not going out to breakfast, you're not buying donuts and cookies and cakes and pastries, and I pack my lunch every day, and you're eating a salad every day instead of going out to lunch, you're going to save a ton of money, way more than you'll ever spend on chiropractic care, supplements, everything I teach you. You're going to save so much money. You can't afford not to do this. And speaking of chiropractic care, if you have problems, make an appointment to come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. Normally, the first visit is $940. I've reduced that for you, my listeners, to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Why wouldn't you do that? X-rays alone are going to cost you more than that anywhere else. Just the x-rays, not the treatment and the evaluation and nutrition. Nutrition alone is going to cost you more than anything. I do that because I want to find out what's going to be the best course of treatment for you. Is it with us? Great. If it's not with us, I'll refer you to somebody who you can hopefully get treated by that can help your health care. So make an appointment, drjoe.com. Yes, we accept almost every insurance, car accidents, sports injuries. Car accidents, if the car is damaged, you're damaged. That's a simple statement. I've never seen it any other way. And I've had countless patients in my 40 years come to me. I was in a car accident and the insurance company wanted to settle, and I settled, and now I have pain. It's 2 years, 5 years, 10, 20 years later. Don't settle until we do an evaluation on you to determine if you have damage. Don't go to the scam artist, the people that call you up, go to this doctor, go to this lawyer. These are runners, they're called, or ambulance chasers. It's illegal, it's a felony, and you're not going to get the care or the legal representation you need. So drjoe.com, just make an appointment. I don't know how, just stop and make your appointment. It's time. So if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about pain management. What does a pain management diet look like? And this is really important, not just for pain, but the same protocols I'm recommending are for general health. They're for life extension. They're for brain health. They're helping to prevent diseases. Not saying it's a guarantee 100%, but we can drop our risk substantially of heart disease, diabetes, cancer, Alzheimer's, Parkinson's, high blood pressure, constipation, irritable bowel syndrome, Crohn's, colitis. I can go on and on and on. You have to have a normally functioning nervous system, normally functioning digestive system, and good nutrition. That's the protocol you have to obtain and maintain good health. It's really just that simple. I wish it could be more complicated. But in most cases, not every case, but most cases, that's going to get you on the road to health. Now, you may need other treatment as well, but you got to start with the basics. So, again, we talked about supplements, Super Green, Central Source, B Complex, and vitamin D. That's the starter kit. Omega-3 fatty acids, essential for brain function. I take nitric oxide to open up my blood vessels and increase circulation, lower blood pressure. Every day on my website, drjoe.com, people send me questions. You can too, drjoe.com, send me your health questions. Every day I get about 8 or 10 of the same questions. What about diabetes? What about high blood pressure? What about belly fat? What about my digestive system? What about my gas, bloating, diarrhea? It's the same questions over and over again. So we have a sampling, I've had a sampling now for 40 years, of what most people need. And I know that most people need diet, healthy nervous system, healthy digestive system, and a good diet. It's just that simple. Quality supplements. Supplements are not an option. They're a necessity for good health. So if you have any questions, drjoe.com. You can book an appointment, drjoe.com. You could search the website. There's a little magnifying glass up in the corner. You can search it. We have about 4,000 hours of content, drjoe.com. I want to be your doctor. Follow me on social media. We post every single day. Dr. Joe Esposito, Facebook, the Dr. Joe Esposito. We post every single day. Podcasts, like podcasts, Dr. Joe for the health of it. Hundreds of hours of podcasts there. Listen to them all. A lot of it's redundant. You're going to say, but I heard that on the last one and this one. Yes, because there's a standard that you have to follow when it comes to health. And most doctors and most hospitals don't follow it. And it's unfortunate. And the reason is they're not trained in it. It's not their fault. Every week I have doctors come in as patients, nurses, healthcare practitioners. And when I explain everything that we do, they're like, I've never heard this before. This is blowing my mind. Why have I not been taught this in medical school, nursing school, orthopedic school, whatever it is? I never heard any of this before. And yet it makes perfect sense. So you have an option now to really, just go supercharge into the future when it comes to healthcare. This will be the future of healthcare, guaranteed, because it works in most cases. So you're going to beat the system by coming to see us. So drjoe.com. So we're talking today about what we can do to manage our pain. We talked about cutting down the omega-6 fatty acids, not just corn oil, but how about corn? Soy. Now, if you're going to do soy, it's okay. People say, well, soy has estrogens in it, and I don't want estrogens. There's different type of estrogens stimulate different receptor sites in the body. Alpha estrogen receptor sites are the ones that can cause abnormal cell growth and cancer. Beta receptor sites actually do the exact opposite. Soy stimulates the beta receptor sites in the body. I have absolutely no qualms doing soy every day. Tofu, organic soy milk, tempeh, miso, no problem whatsoever. I do soy edamame. I do soy aggressively because it's so good for you on so many different levels. So a little bit of information. Yes, soy has estrogen in it, but it's a different type of estrogen that's actually good for you. And it's a phytoestrogen. It's a plant. Plant estrogens don't work on humans. That's why we can't have interspecies mating. Plants and humans have different things. And so soy estrogen is not going to have the impact on the body like an animal estrogen would, like meat or dairy products. So don't worry about that. Soy is fine. You can include things like flaxseed and chia seeds in your diet. And if you want to really get fancy, you can add some chia seeds or flax seeds to that smoothie you're going to make every morning with the super greens, the essential source, the vitamin D, the creatine, which is going to come out in the next couple of weeks, some frozen berries. Now, again, you could just shake it up and drink it if you want to. But if you want to mix in the frozen berries, throw in some chia seeds, some flax seeds, grind it up, you've got an amazing way to start your day. And so much less expensive than anything you're doing right now. All the supplements, the starter kit, Super Green Essential Source B Complex and vitamin D, cheaper than a cup of coffee in a fancy coffee shop. All of them. Why wouldn't you do that? Add the nitric oxide to give you energy, because nitric oxide opens up the blood vessels. We just came out with a new energy supplement. It's called Dr. Joe's Energy Chewables. Why wouldn't you do that? It has nitric oxide and citrulline and ginseng. I love them. When I created them, I got samples, and I was portioning out my samples until I got the actual manufactured product because I was afraid I'd run out. Now we have them, got plenty. We just got a couple of hundred containers of them. So I would say take the Dr. Joe's Energy Boosters, chew 2 of them. They taste great. They taste like candies, like a kid. They're sweetened with stevia. And take 2 or 3 times a day. Amazing energy, amazing thought clarity. And it helps lower your blood pressure and increase the circulation. Heart, lungs, blood vessels, sex organs. Wow, there's no downside to this, is there? Not really, no. And relatively inexpensive. So you want to cut down on your soy, your corn. You want to increase things like flaxseed. Now, you can drink something called green tea. Green tea has caffeine, which is a little bit of caffeine to give you a little energy boost, but also has something called EGCG. And EGCG is a wonderful antioxidant to help the immune system. So if you're going to do organic green tea is the best kind of tea you can drink if you don't mind caffeine. I can't do caffeine. I can't do it. Folks, I'm looking at the clock. I got to go to break. Gosh, I had so much more to cover. If you have any health questions, what do? Go to my website, drjoe.com, and email me your questions. Happy to answer your questions. If you want to make an appointment, drjoe.com. All the supplements we talk about, it's in the store section of the website, drjoe.com. Follow me on social media, Dr. Joe Esposito, Facebook, The Dr. Joe Esposito. We post every single day. If you're a podcast guy or girl, Dr. Joe for the Health of It. Dr. Joe for the Health of It is the podcast. I want to be your doctor. We have and the website alone has over 4,000 hours of content on it. We have so much information I want to share with you because I want to naturally get you well and keep you well. I'm Dr. Joe Esposito. Don't go anywhere. We'll be right back. Okay. You know, I got a problem. I'm putting together way too much information on these shows. I put together 40 tips. I've covered 10. So maybe we'll do part 2 again. Maybe we'll just do part 2 on everything from now on. You have any questions, John?
What is the best garlic powder to use?
Organic garlic powder is great. It does so many different things. So just get an organic garlic powder, use it every day. Quarter teaspoon is really all you need to see the medicinal benefits. So, what else?
Is baking soda and hydrogen peroxide okay and safe to use to whiten your teeth?
Yes, absolutely. But make sure you rinse your mouth out when you're done. Make sure it's food grade hydrogen peroxide. Yes.
I was told that probiotics are histamine liberators and those who break out in hives should not take them. What are your thoughts?
I've never had a patient have that reaction. So maybe it was the probiotic they were taking, but I've never had anybody have that reaction. We have Dr. Joe's probiotics. I take it every day, and I'm very histamine sensitive. I mean, I'm a sissy. If I eat a piece of bread, I swell up. If I take a sip of alcohol, I feel like I'm dopey and my nose runs. So I've never had that reaction. But if that's the case, well, then maybe there is a rare exception, but I've never heard of it. So what else we got?
That is all.
Oh, beautiful. All right, quickies today. All right. I forgot to mention that you can get the show notes in this first part. There, remind me. All right, ready? Hey, folks, Dr. Joe Esposito here. If you just joined me, welcome. If you stayed with me, I appreciate that. I know everybody's busy. We're talking today about pain management diet, the best diet for people in pain. And it kills me when I see patients in pain, if I go to hospitals, if I go to other pain management clinics, that they're having potato chips and they're having soda and they're having diet sodas and they're eating cookies and cakes and hot dogs. And I remember I went to an event the other day and it was at a pain management clinic. And I get invited to a lot of events. So I went to this pain management clinic and they're serving, it was like a barbecue style thing. And it was hot dogs and hamburgers and potato chips and potato salad and sodas and alcohol. And I'm like, you're a pain management clinic. It's kind of like when I see somebody trying to raise money for cancer and it's a bake sale. What's the number one thing that feeds cancer? Sugar. And what are we selling? Cookies and donuts to raise money for cancer research. Here's your cancer research. Stop eating sugar. I just saved you a ton of money. So, anyway, I digress. So we're talking today about pain management. Now, I noticed that I have about 40 different tips I was going to give you on pain management. I've covered 10 so far. I am not going to get to all of them. If you want a copy of today's show notes, and I think you should, send me an email through the website, drjoe.com, and it's absolutely free. I don't charge you. Here's the notes. Do what you want with them. But, yeah, you want to get a copy of the notes, and I do my show notes on just about every show I do. So I'm happy to give them to you. Just send me your email, drjoe.com. In the bottom right-hand corner is a little square. You can click on that, or it says Contact Us. I will send you the show notes, my gift to you. So let's talk about some supplements and nutrients that your body needs to help the brain and the nervous system. Number one is you need a lot of B vitamins because we pee out a lot of our B vitamins. Now, not all of them, of course, will be dead. But you can get your B vitamins from things like lentils, avocados, sunflower seeds. Now, wait a minute. I just said sunflower oil bad. Sunflower seeds good? Doesn't make any sense, Dr. Joe. Yes, it does. Because when you extract the oil out of a sunflower, unless it's organic cold pressed, you're going to change the molecular structure of it. And also, you can do a lot more omega-6 fatty acids in sunflower oil than you would with the seeds because it's so concentrated. So, nuts, seeds, lentils, avocados, they're great for pain. Now, I recommend you take Dr. Joe's methylated B complex every day because many people can't methylate or utilize, I guess is a better way to say it, utilize their B vitamins when they're in a certain form. For example, folic acid, not a good idea. Folate, excellent. Cyanocobalamin has cyanide with it. Not a good idea. Methylcobalamin is B12. Cobalamin is B12 with a methyl group. That's perfectly usable. So I recommend a methylated B complex for everybody every day. It's one of my 4 basics, Super Green Essential Source B complex and vitamin D. Now, I think you should take more supplements. But I've also learned that most people want to start out slow. If you want to do more, nitric oxide, men's hormone support. We have so many others. Turmeric, I'm going to talk about that later. Wonderful anti-inflammatory. So we have turmeric supplements. So there's a lot of supplements you can take. But if you're just willing to, you want to go, dip your toe in the water, Super Green Essential Source B complex and vitamin D, but make sure it's a methylated vitamin B. A lot of people, well, Dr. Joe, I take vitamin B already. I don't need to take that one. Try a methylated one. Many times it's a whole new world. One of my employees, Christy, she doesn't mind me talking about this. She told me she adopted a son who was addicted to drugs. She got him right at birth. And he has a little trouble focusing. So I sat him down one day. Great kid. I love the kid. And I sat him down and I said, hey, listen, I want you to take one of these a day. And I joked with the mom. I said, I don't care what mom says. I want you to take one of these a day. And she said within a week, he was able to sit through the entire class. She goes, he's not fixed, but he's a lot better because he couldn't methylate. He couldn't utilize the B vitamins. That's why you want to do a methylated B complex. So we're talking now about pain management and diet for pain management, and a methylated B complex is necessary for everyone, especially people in pain. We mentioned turmeric. Turmeric is an anti-inflammatory. Dr. Joe's turmeric is in a form that's very easy to absorb. So I recommend I take turmeric every day for many reasons. In fact, there's even some studies suggesting it might help with certain types of cancer. Not saying it's a cure for cancer, suggesting it. Snack on walnuts. You don't know what to eat? Walnuts are great because they're high in what's called ALA, which is a form of omega-3 fatty acids, and that's good as an anti-inflammatory. Don't snack on peanuts. Peanuts are high in omega-6 fatty acids. Not good for you. Almonds, some people have an issue because they have chemicals in it that might increase your risk of kidney stones. If you're eating a small amount of almonds every day, absolutely no problem. But if you have to pick the granddaddy of them all, I would say the walnuts, they're the best. Avocados are just amazing. Now, here's my thing with avocados. If I eat a half an avocado a day, I'm good. If I eat more than a half an avocado a day, I start to gain weight. So half an avocado a day is for me. Now, you might be able to eat a whole avocado and not have a problem. We all have different metabolism. So find out what works for you. And here's the thing that most people do. They don't pay attention to their own lives. I woke up today, I had diarrhea. I woke up today, I had a headache. I couldn't sleep last night. Never thinking that something they did contributed to that problem. That's why I recommend, if you want to get serious, do a diet diary. What a diet diary is, you write down everything you eat. Everything. If it's a piece of gum, if it's a candy, if it's a sip of booze, I don't care. Write it down, and in the margin, write down your symptoms. Wow, my headaches got better today. My headaches were worse. I had fibromyalgia. I was exhausted. My knee hurt. My digestive system was a wreck. And then just go back to that day, or maybe the day before, and look at what you ate. Oh, every time I eat avocados, I put on weight. That's how I learned it. Now, if you don't know what a diet diary is, you can just use a piece of paper. If you go to my website, drjoe.com, and you'll see clinics and then new patient forms. In the new patient forms, you'll see the diet diary. Print it up. It's absolutely free. I don't know you're on the website. I have no idea you're there. And then you can print it up. You have a printed out form. That's my gift to you. I give you guys a lot of gifts. Because I remember years ago, I used to date a gal, and she said, girls love presents. I always joked about that. But everyone loves presents. So I give you this knowledge as my gift to you. What you do with it is up to you. But I really want to be your doctor. I had a patient come in this last week, and he's a young guy. He's going to school for psychology. And we talked for a while. He says, how long have you been in practice? I said, 40 years. He said, I've never met a doctor with so much passion. Certainly not after 40 years. And I said, I love what I do. And I love sharing this knowledge with patients because I have the knowledge. I just want to give it to you guys now. And he said, I'm so impressed because every doctor I've ever met, especially after just 10 or 15 years, get bitter. They get angry. They don't like their job. They want to move on. And here we are sharing this 40 years later because it's fun and it works. And that's why I do it. So hopefully it changed his life too. He said it did. And you really want to stay away from the processed foods, what we call the ultra processed foods or the fried foods. Oh my gosh. I was at a vegan event last weekend and it was called Veg Fest. A lot of fun. And they had food trucks. And they had so many food trucks, I couldn't decide what to eat. But one of them had empanadas. I used to love empanadas. And they were all vegan and it looked great, but they were fried. So just because something is vegan doesn't mean it's healthy, or vegetarian doesn't mean it's healthy. And it had fake meat in it. And fake meat, I can't digest it. It blows me up. Again, diet diary. That's how I learned. And I wanted an empanada so bad because I hadn't had one in like 45 years. But I thought, is it worth it? I always asked myself, is it worth it? The answer was no, it wasn't. So I went home and made eggplant meatballs. And I tried to make them taste like my grandmother's, and they tasted really good. And it's take an eggplant, chop it up, steam it a little bit, put it in a food processor, add some seasoning and stuff. So I put in organic breadcrumbs. Again, cooked, baked, bread, frozen, defrosted, made into breadcrumbs. Spectacular. But I digress. So you really want to limit the processed and the fried foods. Now, here's a good rule if you want to know if a food is processed. If you can't pronounce the ingredients, don't eat it. Just that simple. Now, there are some things you can't pronounce, like methylcobalamin, perhaps. That's good for you, but generally speaking, if you don't have it in your kitchen, if it's not an ingredient you can't pronounce, just don't eat it. It's really just that simple. If it comes in a package, you probably shouldn't eat it anyway, but that's not always true. I'm joking about that. So people talk a lot about calcium. I get this question probably about 8 or 10 times a week on my website. Well, Dr. Joe, I have thin bones. Doctor said I should take calcium. And I don't mean to be a jerk, but I think to myself, what kind of calcium? Calcium carbonate, calcium citrate, calcium lactate. You're going to do vitamin D3 with it. You're going to have enough K2 to absorb the calcium from the food into the blood and take it into the bones. If you take D3 without K2, you can't absorb it into the bones. Is it really calcium or magnesium? Maybe it's boron, silica when it comes to bone health. And again, my brain races like this. And I don't want to be a jerk, but saying you have weak bones, take calcium is like saying, I want to make a cake and I only have flour. So can I make a cake? No, you can't. Flour is the main ingredient, but you need everything else. You need, baking powder, baking soda, whatever it is. You might need a binder. You might need flavoring. So you can't make a cake with just flour. You can't build a bone with just calcium. And calcium carbonate is junk. Calcium carbonate is a chalk that you write on a chalkboard with. It can block up your receptor sites and prevent you from absorbing other forms of calcium. So when people say I need calcium, not a good idea. How about we just eat calcium-rich foods? Well, what's a calcium-rich food? How about collards, bok choy? I was having dinner the other night, and somebody there was Chinese, and they said, Dr. Joe, you're the nutrition guy. Do you like bok choy? I said, I love bok choy. You know what bok choy is? I said, yeah, I know what bok choy is. Yeah, it's great. So that's going to help build strong bones. If you have weak bones, you can send me an email through the website, drjoe.com, and I'll send you a lecture that I did on the truth about how to build healthy bones. In fact, any question you have, I've probably done a podcast or a show on it. I will send you that link as a gift. So if you have pain management, this is a pain management class right now. Happy to be there for you. Any question you have, just send it to me, drjoe.com. Ginger is wonderful. Not from Gilligan's Island. Well, ginger from Gilligan's Island, I'm sure, is wonderful. But ginger, the root is wonderful. It's anti-inflammatory. Now, there's two types of ginger. One that's kind of wrinkled up and smaller, and then these big monster-sized ginger. Don't do the monster-sized ginger. The smaller ones, the organic ones, are going to be a much better choice. So ginger is a wonderful anti-inflammatory. And what I do is I'll buy a bunch of ginger, and I'll peel it. I have a glove I wear because I don't want a potato peeler cutting my fingers because I learned that lesson a lot. And I wear this glove, and you can get them in any food store, really. And I peel the ginger, put it in a food processor, and cover it about halfway with organic lemon juice. And then I puree the heck out of it because it's stringy. And then I put it in an ice cube tray, and I freeze it. And I have these ice cubes of ginger and lemon juice in my freezer. It makes a wonderful tea. If I'm cooking a stir fry, I can throw it in my stir fry. But that's a great way to get ginger into your body. You can take ginger supplements too, but I like the fresh. And I make a tea. If you eat honey, you can put honey in there or stevia. I do this mainly in the winter, but I feel great when I do it. It gives you so much energy. It's an aphrodisiac too, so be careful with that. I don't want to get blamed for anything. But it's wonderful. And you feel great, really warms you in the winter. Now in the summer, what you can do is you could make a little tea with it, sweeten it however you want to, not with sugar, of course. And then add some seltzer, and you got ginger ale. How cool is that? Little fun tip for you there. You want to make sure you're drinking enough water. So many times with my patients that are in pain, they're just dehydrated. And so I tell them, you got to start drinking water. Herbal teas work well, too. And you can do chamomile tea, very calming to the body. Slippery elm, very calming to the mucous membranes. Licorice tea, good for the adrenal glands. So you can do herbal teas or sweetened with stevia, or you can just do water. If you don't like water, add some lemon juice to it, add some stevia to it. You got a good combination there. Pumpkin seeds are great because they're high in zinc and magnesium. Magnesium does what? It relaxes the body. And you've really got to limit your alcohol. If you have any type of pain, I suggest you cut out the alcohol. If you won't cut it out, cut back on it, and every time you go drinking, you have to have an extra serving of Super Greens Essential Source and B-Complex. You already took it in the morning once. You're going to take it a second time if you have any alcohol. You have to replace the damage that the alcohol did. And if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about a diet for pain management. Now, as a pain management expert, we can give you the best chiropractic care in the world. You can have the best surgery in the world, the best injections in the world, the best ablations in the world, all these fancy words. But if you're not willing to stop eating the things that cause inflammation, you're not going to get all the benefits that you can. It's very simple. So if you have pain, chiropractic care, most effective, least expensive treatment for pain. If you want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. I want to be your doctor. So go to my website, drjoe.com, book your appointment. Normally the first visit is $940. I've reduced that to $299 for you, my listeners. That's an exam, x-rays, consultation, first treatment, going over the x-rays on a follow-up visit, and a complete nutrition evaluation. X-rays alone are going to cost more than that anywhere else. I do this because I want to find out what's going to be the best course of treatment for you. Is it us? Great. If it's orthopedist, neurologist, psychiatrist, whatever it is, we're going to get you in the direction where you need to be. So drjoe.com, book your appointment. Yes, we accept almost every insurance. We're on a VA referral list. Car accidents, I teach doctors all around the world on car accidents. In fact, I'm speaking at a conference in a couple of weeks, international conference on traumatic brain injuries. I'm doing the part on nutrition, surprisingly, and how the brain can be healed many times or start to heal with proper nutrition. So drjoe.com, make your appointment, stop suffering. It breaks my heart when patients come to me and say, Dr. Joe, I'm like all your other patients. I should have come here a week ago, a month ago, a year ago, 20, 30 years ago. I wish I'd come sooner. Why didn't I do this sooner? And my answer is, I don't know. I have no idea. So come see us, drjoe.com. Stop suffering. And bring your kids, too. Kids need a tune-up, too. You have to balance your blood sugar. We're talking today about pain management. Keep your blood sugar stable. Things that'll stabilize blood sugar. Fiber. If you're eating a high-fiber diet, it'll stabilize blood sugar in most cases. Protein. Have a couple of handfuls of nuts or seeds. If you're going to eat sugar, stabilize the blood sugar. Vinegar. Apple cider vinegar specifically, but any vinegar really will help stabilize blood sugar. So if you're going to cheat, I wish you wouldn't, but if you're going to cheat, have some fiber with it. Have a salad with it. Have some vinegar. Put some vinegar on your salad and add some chickpeas to it or some pumpkin seeds or some sunflower seeds. And then you get the protein, the fiber, and the vinegar to stabilize that blood sugar. Because when the sugar spikes and then crashes, that can really increase your pain. Of course, avoid soda and sweetened beverages. I don't think I need to tell you that because we keep talking about sugar. Cinnamon works very well for stabilizing blood sugar. What I'm teaching you today is brown belt nutrition. If you want to go to black belt nutrition, when you make your smoothie in the morning with Super Green Essential Source, some frozen berries or some frozen figs, you're going to add the vitamin D to it. You're going to add creatine to it. We have the creatine on the website very shortly. Add some cinnamon to it, maybe a teaspoon of cinnamon. Now we're going to black belt nutrition. Again, cheaper than a coffee at a fancy coffee shop. Why wouldn't you do this? And here's what's going to happen. Once you start changing your diet, a lot of the cravings you have for the junk food and the coffee, they just go away. It's the weirdest thing. Maybe you love, bubble tea. I'm making something up here. Or cinnamon rolls. Once you get the body healthy, you look at a cinnamon roll and go, they look good. I don't feel like spending $10 though. Where in the past you go, oh, it's $10, it's a treat. I worked hard, I worked out, I'm going to give myself a treat. You go, that's not the best choice. I promise you it works. Now, I'm not going to get to all my notes today. I promise you that, too. If you want today's notes, send me an email through the website, drjoe.com. I will send you what we call the show notes. Absolutely free. It's my gift to you. Just send me an email. Say you want to put pain management in the title, and I will send you the notes for the pain management class. I do it for most of my shows, so this is not uncommon. But if you want all this, and you should, by the way, because I know you can't keep up with me. I can't keep up with me. You probably want to do that right away, okay? The gut is so important when it comes to health. If you have acid reflux, heartburn, burping, gas, bloating, irritable bowel syndrome, Crohn's, colitis, diarrhea, constipation, these are all signs that the gut is not absorbing nutrients properly and you have a lot of inflammation. So if you have acid reflux, for example, there's a technique we use where we can actually pull the stomach down away from the diaphragm. It's a phenomenal technique. And it helps bring down the inflammation, but it more importantly helps you digest your food better. And it helps produce neurotransmitters in the brain more efficiently. So if you have heartburn or acid reflux, come see us. If you have pain, come see us. This is what you need to do on your own. Hormones can be a big issue. We have a test that we do called the Dutch test, DUTCH, really important for men and women. And we do urine samples on you throughout the day. You do it at home, actually. And we get the report back. The report is so confusing. I don't know who wrote these reports, but I'll go over it with you. One of my doctors will go over what we found. Where's the problem with your hormones? Oh, it's an estrogen thing. Well, there's 3 types of estrogen. Which one is it? Are you not detoxifying? You're making too much, too little? Is there an imbalance? Just looking at estrogen doesn't do me a whole lot of good. Same thing with testosterone. Is it free testosterone? Is it bound testosterone? Which one is it? Are other male hormones that are somehow involved? Is the estrogen-testosterone balance correct? So that's why we like to do the Dutch test. It's really important, especially when it comes to pain management. Other foods we can eat, we talked about that. I know I'm running out of time. Mushrooms, especially shiitake and maitake, help the immune system and help bring down inflammation. So we talked about the greens. We talk about shiitakes and maitakes as well. Lentils, chickpeas, legumes, any type of legume really. Organic soybeans, wonderful for pain management. And it kills me that there's a whole branch. When I first got into this field, there was no such thing as a pain management branch. Now there's a whole field of pain management. I'm on the board. I'm board certified. And it's all about what? Pain management. Not fixing the pain, managing the pain. And so I remember at a conference one day, and I was the only non-medical person there. And everybody's pointing to me. That's the guy. That's Dr. Joe. That's Dr. Joe. And I remember I walked into the men's room. Some guy followed me in and starts talking to me. Hey, I got this patient, Dr. Joe, and we did this and this and this, and it's not working, and what would you recommend we do? And I had to laugh. I said, can we talk outside the bathroom maybe? But doctors get so excited about this because they've never heard this before. Diet affects pain? Yeah. Chiropractic care is the most effective, least expensive treatment for pain management? Yeah. Supplements can help pain? Yes. This stuff isn't being taught. In most cases, I can't say every case, in most cases it's not being taught. And that's my job, is to teach you, but also teach my colleagues. Because I don't want to be in pain, you don't want to be in pain, and if you're doing something every day, diet soda, number 1 side effect of aspartame, headaches. I cannot tell you how many patients I've seen in the past 40 years that have had headaches. I get them off their diet soda and headaches go away. And they've been to pain management. They've had injections. They've had Botox. They've tried every drug on the market. I remember talking to a pain management headache specialist one time. And I said, so I have headaches. I was hit by a car, and I have headaches. What do you do? Well, you just have to learn to live with it. I swear this is what she said. You have to learn to live with it. Most people in your condition are not going to become CEOs. You're not going to be leaders in industry. You just have to manage your pain, accept the fact that you're a headache patient, and get on with your life. And it can affect your relationships. It can affect your family. It can affect your finances. But there's not much we can do for headache patients after we've gone through the injections and the drugs. And I said to her, well, I can't do caffeine. If I do caffeine, I get a headache. And she goes, oh, well, then you probably shouldn't do caffeine. I said, gee, thanks, Captain Obvious. So eating a good diet is really important. And sleep, of course, stress is a key player when it comes to pain management. Avoiding caffeine, I'm the case of that, of course. But stress management, there's 3 types of stress: chemical, physical, and emotional stress. The physical stress, come see us for. My team of doctors and I really good at dealing with stress, pain, physical stress. Chemical stress, that's why you listen to my shows. That's why you follow me on Facebook and follow me on YouTube. We have the long and short versions on YouTube of my lectures. Why you follow me on a podcast, Dr. Joe for the Health of It. That's teaching you the management of the chemistry in your body, your diet, your environment, your clothes soap. I had a patient come in the other day. He said, Doc, my testosterone is through the floor. And he smelled like dryer sheets. I said, you know dryer sheets can lower your testosterone? He goes, what do you mean? I said, they're xenoestrogens, which affect testosterone levels. He said, nobody's ever told me that. I've been to 3 different fertility clinics and male doctors. Nobody ever told me that. I said, start using natural soap. All right, almost out of time. I didn't cover everything. If you want a copy of today's show notes, just send me an email through the website, drjoe.com, and just say pain management on it. I'll send you notes. My gift, absolutely free. It's my gift to you. If you have any questions, send them to me through the website. Happy to answer your questions. Send them 24 hours a day. I'll get to them as soon as I can. I usually answer within 24 hours. drjoe.com. You can book an appointment. drjoe.com. Supplements, where? drjoe.com in the store section. Search the website. It's a little magnifying glass on top. Search the website. Spend some time. I want to be your doctor. I really do. And we can do it virtually. We can do it in person. Supplement recommendations. I want to get to the cause of your healthcare problems and not just treat the symptoms. drjoe.com. Thanks for tuning in, folks. All right. You have questions for me?
Is corn on the cob okay?
If it's organic, yes. If it's not organic, no. If it's not organic, it could be genetically modified, and that can really increase your inflammation. So,
I prefer ranch dressing on my salads, but I know it's not the best choice. Should I simply eat less or use light ranch instead?
light ranch might have artificial sweeteners in it. I would say go on the website, go on the internet, and look up a vegan ranch dressing. That would be a better choice. So, and then use as little as possible. What else?
Do you recommend 1,500 or 2,500 calories a day?
It depends. That has a lot. Boy, that's a really vague question. That's a Sophie's choice right there. I usually do around 1,500 a day, sometimes 2,000 a day. At my age, my weight, about 185 pounds, I find that maintains me. If I start going above that, I start to put on weight. Are you male? Are you female? Are you young? Are you old? Are you active? You're not active. So there really isn't a question there. The less, the better. I want you to have quality calories. So I'd rather have you have 2,000 quality calories than 1,500 of junk. So just eat good food. It's really just that simple. If you start gaining weight, you're eating too much. If you start losing weight, you're eating too little. So what else?
I like to mix together broccoli, green beans, and sweet peas and cook with coconut oil. Anything I should add to this?
Nope. You could add air-dried sea salt if you want to. Air-dried sea salt's great. Hot peppers are great. If you want to add a spiciness to it, it's a vasodilator loaded with antioxidants. Garlic would be good. Garlic, antibiotic, antiviral, and antifungal. Oregano, same thing, antibiotic, antifungal. I love spices. I just go crazy on my spices. Sometimes I screw up, but most times it's pretty good. What else?
That is all.
Thanks, guys. Appreciate it. You're going to follow me?